day, everyone. I'm Giselle Danier from Asian College of Technology, College of Nursing, NU 303. So today is I'm going to perform the bag technique. So bag technique is a tool making use of a public health bag through which the nurse, during his her home visit, can perform nursing procedures with ease and deftness, saving time and effort with the end of view of rendering effective nursing care. So the public health bag is an essential and indispensable equipment of the public health nurse, which he she has to carry along when he she goes out home visiting. So it contains basic medications and articles which are necessary for giving care. So the rationale of the bag technique is to render effective nursing care to clients and or to members of the family during home visits. So there are principles in the bag technique. So first is the use of the bag technique should minimize, if not totally prevent, the spread of infection from the individuals to families, hence to the community. Second is bag technique should save time and effort on the part of the nurse in the performance of nursing procedure. And third is bag technique should not be overshadow concern for the patient, rather should show the effectiveness of total care given to individual or family. Fourth is bag technique can be performed in a variety of ways depending upon agency policies. So there are actual home situation and etc. So as long as principles of avoiding transfer of infection is carried out. So there are special considerations of the bag. So the bag should contain all necessary articles, supplies, equipments which may be used to answer emergency needs. The bag and its contents should be cleaned as often as possible, supplies replaced and ready for use at any time. And the bag and its contents should be well protected from contact with any article in the home of the patients. Consider the bag and its contents clean and or sterile, which any article belonging to the patient is dirty and contaminated. So the arrangement of the contents of the bag should be the one most convenient to the user or to facilitate efficiency and avoid confusion. And hand washing is done as frequently as the situation calls for. It helps in minimizing or avoiding contamination of the bag and its contents. And lastly, the bag when used for a communicable case should be thoroughly cleaned and disinfected before keeping and reusing. So the contents of the bag, I will discuss it later as I proceed to doing the bag. Upon arriving to the client's home, establish report as the client for a flat surface or a clean flat surface table or a chair that we can put the bag, the patient bag. So the procedure, let's proceed to the procedure of the bag technique. So I'm going to take out the paper linen. So the clean part is on the bag and the dirty part, the outer part is on the table. So after putting the paper linen, is I'm going to put the plastic linen. So same thing, the inner part is on the bag. So close the bag and then put the bag on the corner. So the rationale for this is to protect the bag from contamination. So after that is I'm going to ask the client or the homeowner for basin of water, or I'm going to ask where is the sink to for me to wash my hands, do the hand washing. The rationale of the hand washing is to prevent contamination. So, and also the rationale of the basin away from the workplace is to prevent the work area to be wet from the water if there is no sinking. So I need to wash my hand in a basin away from the work area. So after that is I'm going to do hand washing. So remove the wristwatch and then so after doing the hand washing is take out the apron and put the apron right side out and wrong side with crease touching the body. So sliding the head into the neck strap neatly and tie the straps at the back. So put on things not most needed for the specific case. For example, we do the one dressing, so we need the OS, the betadine, the iodine, and everything that is needed for the specific procedure. Or we need to do the Benedict's or ascetic test, or we need to do the immediate newborn care. We have the sterile cord clamp, and of course the the scissors the are being sterile. Of course we need to use sterile for the immediate newborn care, and we have the weighing scale, and it depends. You can take out the contents what you are needed for the said procedure. So after doing the procedure is we have the waist recept we have the uh, receptacle, waste paper bag outside of the work area. So we have this one, and we have another cellophane or like that, and then close the bag and do the procedure. Close the bag, and when what you wish to, for example, we're going to do the acetic and Benedict test. So I'm going to take out the match, the dropper, the um, test tube, the test tube holder, and the solution, the Benedict solution and the acetic solution, and the urine cup, and the clean gloves. We have the clean gloves and the syringes. So we have syringes to measure the urine, and syringes, and also we have the alcohol lump. So I bring a denatured alcohol for the procedure. So this is a denatured alcohol, just I put it on a small container. So after doing the procedure is after getting out the contents is I'm going to close it. So this is to give comfort and security and maintain personal hygiene and hasten recovery. So I'm going to proceed to the specific nursing care to procedure. So after completing nursing care or treatment, I'm going to the clean and alcoholize the things being used. So I'm going to wash all these things and discard the gloves, the things that cannot be recycled. So I'm going to clean this one and alcoholize it, wipe it in a tissue, and then put it in a Lysol or anything that which would clean the equipments. So after that is I'm going to do hand washing again. So after cleaning is I'm going to do hand washing. So after doing the hand washing, open the bag and put back all the articles in their proper places. So um, I'm going to open the bag, so this one, to the proper places. So the solutions are put in the pocket inside of the speech and bag. And then I'm going to put the soup and soup dish. So I'm going to remove apron folding away from the body with the soiled side folded inwards and the clean side out. So place it in the bag. And then fold the linen plastic lining clean. Fold the plastic lining from clean to, and put it in the bag. So after that is I'm going to discard the paper linen and with a receptacle. I'm going to ask the homeowner if they have trash can for the waste product like that. And then after that is I'm going to make a post BSET conference on matters relevant to healthcare, taking anecdotal notes preparatory to final reporting, and this is to be used as reference for future visit. And next is I'm going to make appointment for the next visit, so either home or clinic, so taking note of the date, time, and the purpose. This is for the purpose is to for follow-up care. So after care is before keeping all articles in the bag, clean and alcoholize them. Get the bag from the table, fold the paper lining and insert and place it in between the flaps and cover the bag. So in that case, if the paper lining is very soiled, very contaminated, you can throw it that away. And I have another extra paper lining inside my bag. So the evaluation and documentation. Third is record all relevant findings about the client and members of the family. Fourth is take note of environmental factors which affect the client's family health. Fifth is include quality of nurse patient relationship. So um, build a good relationship to the patient. And six is assess effectiveness of nursing care provided. So that's all for the back technique, and thank you.